It's an incredible honor to be here and spend this time with you today. And that just ruined the first 2 pages. You guys, I was going to talk about myself for a little while. It is an honor, and I appreciate you extending the time to learn a little more about cancer support community and the work that we do and the desperate need that we have in our communities for the role of support in a cancer care continuum. So I will talk for a little bit about my personal experience. I do get choked up a little bit. Enough time doesn't ever go by when I hear about things in my father's name and in my mother's name, so bear with me. I am the president and founder of Involve Media. We are a brand activation agency, and we take a humanistic approach to branding, and have learned a lot from cancer support community and all that we do and how we approach branding and marketing to make sure that there is deep human connection in everything that we do through marketing and through branding. But I'm here to talk to you as board member in Cancer Support Community, Central Ohio. Before we go on with that presentation, and now that you're nice and full, can you do me a favor and everybody stand up once again? Everybody. I promise this is the last physical test of the day. So listen closely. If you have never been diagnosed with cancer, if you have never had a family member diagnosed with cancer, if you don't have a friend or a coworker that's ever been diagnosed with cancer, take a seat. Everybody else remain standing. My desperate hope was a few of you might have sat down, but you're all standing up, and I stand here with you, and this is why we're here today. I'm going to share you a little bit of my story because I stand with you because my family's certainly been impacted by cancer. Everybody take a seat, please, and thank you very much for that. So I lost my mother and my father to lung cancer, the #1 cancer killer that takes more lives than any other cancer. Sure. Normally people yell at me for being too loud. Is that better? So as I was saying, lost my father and my mother to lung cancer. My father, it's about 12 years ago, and it was an incredibly short journey. It was about 7 weeks from diagnosis to funeral. But that's how it was supposed to go with him. About 6 out of those 7 weeks, he was him. He was taking care of us more than we were taking care of him. And the story went as the story was supposed to. But the impact of that short period is that I didn't learn much. I didn't learn about the journey. You can't learn too much in 7 weeks when you hear the diagnosis of cancer. You are angry that your time may be cut short. You're in an absolute surreal head-spinning space for a duration of time. All you can do is be in it and be with it and get through it and then heal from it. So at that time, I was living in Chicago, and I wasn't looking for something to hold on to, but an industry associate pointed me to a need from an organization that was national, based in Chicago, and that was Longevity Foundation. And Longevity is the largest grassroots organization devoted to purely lung cancer, and since inception has devoted $20 million to research. But I served at first by consulting on branding and events and sponsorship and communications, those that are in my wheelhouse. And soon after, I was honored with the invitation to sit on their national board. That was quite flattering. I had never been in a board seat in my life. This was a national charity. This was a national seat. It happened to be the cause that just took my father's life. So it was pretty emotionally charged and pretty exhilarating and something that changed my life. After a short time, I eventually moved back to Columbus, where I spent most of my young years here. And at that time, I met a lot of other board members and leaders of cancer-related organizations in town, and that's when I met this amazing lady, Bev Salt, tireless, passionate, fearless leader and our CEO that drives so much of this amazing work that I'm going to tell you about today. it was with Bev that I first understood and was educated about the journey itself. Those of you who have been through the battle and close to the battle, you kind of understand my words when I talk about the journey. But I understood more than fundraising, research, the science, the tragedies. I started to understand more about the people, the person, the journey, and the life, and the quality of life, and the variety of people who go through this particular journey. So my national position with longevity came to a close, and about a minute and a half later, Bev and Skip Weiler, a past chairman and an ongoing driving force at Cancer Support Community, they swooped in, and I'll warn all of you that if you end up in a room with Skip and Bev, you have no prayer, you have no shot. They will leverage every passion and cause-related element, and you will walk out doing something you didn't expect to do. And here I am, a board member. So I value that, but it was shortly after that that I got the news of my mother's diagnosis. So Mom had been a breast cancer survivor, and she was diagnosed with lung cancer. And we had a little bit of a longer journey with Mom, and I got to learn a little more. And there were surgeries, there were treatments, there was clinical studies, there were trials, and I had the benefit and fortune, sometimes everything happens as it's supposed to happen, right? I had the knowledge and support of this amazing organization and my fellow board members, and Bev most of all. And I got to use the tools I was given to not just understand how to support, how to coach and be a caregiver. I could have read a book, it's plenty of articles about that. I got to feel the difference. I got to understand the incredible and important role that support services play in the cancer care continuum. Equally as important as any of the medical care that we discuss is the role of psychosocial support. And that's what I'm here to drive home with you today, is that message. So not everybody understands the need, everybody understands that resources are available, but at Cancer Support Community, we're here to make sure that they do and that nobody has to go through cancer alone. So, do you mind? Yep. All right. We provide the critical support services that are desperately needed by those impacted by cancer. Everyone impacted by cancer deserves to be empowered to find a place that is community, to get educated, to benefit from professionally led support, and to actually pay it forward and help inform the next generation of cancer care through their experiences. Well, Cancer Support Community, we're here to make sure that nobody goes through cancer alone. So a bit about the organization. Cancer Support Community is a local affiliate of a national organization. We have our building on Old Henderson Road just off of Kenny, a beautiful facility where we have our administrative operations and also host most of our support groups. We primarily support Franklin County and our contiguous counties, but we have people coming from all over the state for some of our amazing programs. Nationally, Cancer Support Community has over 50 affiliates across the country with 170 satellite locations. As part of being affiliated with the national organizations, we have tremendous benefit by benefiting from their resources and research for all of our programs. We benefit from 30 years of experience with empowering the patient and everybody around that patient. And nationally, Cancer Support Community served over 1 million people impacted by cancer last year. You can clap for a minute for that. A million's a lot of people. So going back to that exercise, my notes say where we stood up and sat down, but actually it's when we all stood up. Some of the harsh numbers to consider is 1 in 3 women and 1 in 2 men will be diagnosed with cancer in their lifetime. That equates to 3 out of 4 families getting impacted and a number of 1.6 million diagnoses every year. And that's just in the United States. So let's bring it down from the United States to our neighborhoods in Central Ohio. 22 people every single day around us here in Central Ohio are going to hear the words, "You have cancer." That's more than 8,000 people here around us, again, in our community, that will hear those words. As I was alluding to earlier, the diagnosis of cancer has implications that extend far beyond the physical ramifications within the patient of the disease. The impact of cancer extends to our friends, our family, our coworkers, those who are closest to us and provide our care. So thinking about impact beyond those 22 people a day who hear those words, if you do a little bit of math and think about just the closest circle within the Doppler effect there, and just use a conservative number of 4. 4 people around those 22 people being impacted by this disease equates to over 32,000 people per year. In Central Ohio, additional people impacted by cancer every year. And I think that number's kind of shy. A lot of us in this room especially are blessed with more than 4 people in our closest circle. I say that it's tens of thousands of more people that are impacted than 32,000 in our market alone. So this is what it's all about. We can help. Our sole focus is to assure that psychosocial services and needs are met and are addressed. We are incredibly blessed in Central Ohio to have the hospitals and cancer centers that we do have here. And some of them certainly provide psychosocial and support services. But we differ from some of these organizations in a few very important ways. What you'll hear me say about another 9 times today is that we offer all of our programs at no charge, all of them. Our programs are available to anyone impacted by cancer. That's not just the patient. That's the child, that's the sibling, that's the family member, that's the coworker, that's the caregiver. Everybody needs psychosocial support, everybody needs emotional support, and everybody needs to learn how to deal with what they have at hand. And there is also no limit to how long our participants can stay in the program. It's not, you've had your treatment, be here in support for 3 months, and then a nice pat on the butt and we'll tell you where to go read more about this. You can stay as long as you want because we're here for you as long as you want. And then all of our programs are facilitated by licensed and credentialed healthcare workers and professionals, and everything that we do is research and evidence-based. We do all this, again, so nobody faces cancer alone, and we do it all at no cost. That's 1, 8 more coming. So what does this look like? Our support services, and all these photos are from our facility right now. We offer a variety of support groups. As you can imagine, there's a variety of groups that address cancer-specific and cancer-type-specific programs. We have one-on-one counseling, and when needed, anyone can walk away with a personalized care plan. We have an amazing selection of healthy lifestyle programs. They include cooking and nutrition programs led by our executive chef and dietitian from Giant Eagle, and a lot of those programs are held right in our facility in the Giant Eagle demonstration kitchen. Exercise programs like yoga and Tai Chi and our wellness workouts, they help to build core strength, certainly reduce fatigue, and physically and mind, body, spirit, everybody walks away feeling so much better and drives more hope. Stress management programs like journaling, mindful meditation, among others, all contribute to the soul and the hope and the physical being of our members. Every month at our board meetings, we have a beautiful moment with, we call it the mission moment, where a participant or a group of participants come in and it allows our board to feel the difference that we're making. It is very rare that there's a dry eye in a crowd when we get to feel what our members are feeling, and it's explanations, it's expressions of hope. But you know, they go through specific examples on how they were better educated, better prepared, more empowered. But it's funny that when you go to a lot of these healthy lifestyle events, that's where the stories go on the longest. I think it's because of human interaction and human support, one-on-one and peer-to-peer. I've gone through a couple cancer journeys, but I'm not equipped to stand shoulder to shoulder and say I know what you're going through with another cancer survivor. But through these healthy lifestyle events, you find that camaraderie, you find that connection, you find that so much more lately our mission moments have two people coming together. And they talk about how one held up the other. And again, not a dry eye in a crowd when we go through some of these. From an educational standpoint, we have plenty of workshops on a variety of subjects. We have Lunch and Learn series, again, variety of topics, and I think we have one or two people in the room that have led those. We have Walk with a Doc, and we have an extensive library, a physical library inside our facility with resources from so many different great organizations and agencies that are going to help our members along. Our social connections, these are fantastic because it helps people connect to each other again in a more of a social and comfortable setting. They share their experiences one-on-one, and there's such a variety of these casual events and settings set up that not everything's for everybody, and we get to see a lot of, again, our members holding up other members. And they're always open not just to the patients, but also to all their caregivers, friends, and such. So this is a better picture of our resource library, but not everybody knows what to do. Not everybody even knows how to search the internet, and not everybody knows what to believe. But when you come and spend time, assisted or unassisted, in our library, you can find things like what we produce, frankly speaking, about cancer, and all the resources you might need in the way of your specific type of cancer. We also take it beyond the brochure, the book, the dialogue, and we tactically assist our members in anything they need. It could be finding them a ride to their appointment. It could be, where do I find a wig? I just heard I'm going to lose all my hair. It doesn't matter. We're there and we take them as far along the journey as they need to go with our arms around them. So I spoke earlier about my education, and now I want to dive a little deeper into your education and learning about the role of support, not just we're here to provide it. So let's talk about distress. Distress can actually affect the progress of a patient, their ability to cope, and how they move along, and what happens when it goes undiagnosed. So 80%, as we've done our research through our Cancer Experience Registry, which is our tool, 87% have reported significant distress in one or more parts of their lives since their diagnosis. So distress literally obstructs care. It keeps the patient from adhering to treatment, from seeking other options, and it does affect the course of the disease. So if you're one of those who don't appreciate, understand, or respect the fact that the mind, body, and spirit are deeply connected, this is data that tells you you couldn't be more wrong. We can even start to put the idea of stress into dollars and cents. We know for a fact that psychological distress and depression can contribute to upwards of $8,400 in additional healthcare costs with that individual. So whether you're more impressed with my numbers with a dollar sign in front of it, or you're more impressed with the impact that it has negatively on the patient care continuum and the ability to seek and receive the benefits of their care, or hopefully you understand both of those, the bottom line is support is desperately needed, and we need to address the emotional needs of the cancer patient and everyone around them. So where does that start? Naturally, it's with the provider. When they hear those words and they start getting discussions about their treatment, their options, and their course moving forward through this journey. But what we hear from patients is that they might only receive the physical components of the treatment from their physicians, and they might not even get a discussion, and they are overlooked when it comes to their emotional needs. Some patients tell us their providers don't understand the role of emotional support and psychosocial support in the cancer care continuum. They might be unaware of where to send them for resources. And the recognition and adequate treatment, once it's even recognized, due to their illness, there was no action taken. So one stat I'd like to quote for you that's mind-boggling to me is between 45 and 70% of survivors were never even asked about distress by their healthcare team or referred to any kind of support service. So the need is there, the impact of distress is palpable, but now let me talk about the progress that's being made because it is great positive news. So let's talk about treating the whole person because that is what I'm talking about in every one of these slides. In 2007, the Institute of Medicine report acknowledged that care for the whole patient is critical. Their report says, and I quote, "Psychosocial services are essential components of comprehensive cancer care." And to me, the most monumental shift in this issue has to be looked at as the newest mandate that says that to be accredited, a cancer care center must now assess patients for psychosocial needs that result from a cancer diagnosis and refer them for services. This is now not a feeling that emotion and support can help. This is now a mandate, and it's scientifically proven, and it's part of the cancer care continuum. So when it comes to distress, when it comes to treating the patient, we know for a fact that support is valuable, and what do we do about it? So key elements are the identification and addressing of distress. Cancer support source is our tool. It's our screening tool. So identifying and addressing how they're coping and the important concerns that lead to improved quality of life, this has to be discovered and this has to be addressed. So with cancer support source, we do step one at first. Open the conversation and understand where they are and about their needs. We identify the specific concerns the patient and the family have. They get addressed before those concerns become barriers to care. And then it involves a one-on-one meeting with a professional for the patient to understand exactly what their results were. And then it ends with an individualized care plan based on their needs, type of cancer, and the services that will make the most impact on that unique situation for that patient. So it works. We make an impact, and we get the right feedback. The real impact, I'll read these to you one at a time. 93% of our respondents say they feel less alone. 95% gained a better understanding of what to ask their healthcare team. 93% are better able to make decisions about their treatment options. 96% report a decrease in psychological distress, and 98% find that participating in a cancer support community has helped increase their feelings of hope. This is empowerment, and this is what improves quality of life and length of life. So getting into a little more of the nuts and bolts about our organization, we are a financially sound organization. We stand alone as an affiliate here in Central Ohio. Much of our funding comes from support from corporations, from private donors, from foundations, a little bit, of course, from government funding and grants, and we run a pretty tight and managed budget and do a great job of bringing more and more people into our world every single year. We are on path this year to have 600 unique new members into just Central Ohio's programs. It's not a million, so you don't have to clap for 600. So I hope some of you towards the back can read this, because I want to leave this up for a second. I know it's a little small on the screen so far away, but we have an amazing board of directors, me excluded, of course. We have a tireless staff, and we have a large board of directors. If I could ask you to take just a few seconds and scan that list of board of directors. If you reach out and know them and they're very prominent in the community and say thank you, that's awesome. But more importantly, I want you to know that you have a direct connect, a hand to shake and a shoulder to lean on for any one of our board members, Judy one of them of course, that if there's anything you ever need for you, your family, and friends, These are all names of people who are waiting to talk to you and will be glad to help you through any journey and any of your needs. So, some of the things that we do each year that some of you I'm sure have been to, we have some significant fundraising events, 2 signature events. One largest is Night of Chocolate. We always talk about it as the premier chocolate event in the country. Or the state actually, but just the fact that we measure chocolate events is impressive to me, but it's quite impressive. But has anybody been to the event? Some hands up? Excellent, excellent. So hosted by Hollywood Casino, who does an amazing job. Their chefs do an amazing job with the cuisine. There's over 10,000 pieces of chocolate. Shame on you if you can't find something to enjoy there. But we have a great program. We have some nice awards. We have a silent and live auction and some great experiences that come through that auction. And this year it's on September 22nd, and we hope that all of you can join us. The charity golf outing is always a fun time. We sell out every year at 180 folks. It is hosted at Medallion, a beautiful course, and they go all out with their hospitality. We have some of the usual suspects with the fun prizes and the hole-in-one contest, and as a special entertainment opportunity, I don't play as much as I used to, so if you follow my group, you get to learn things like some new curse words and the proper way to throw a 5-iron in the woods. There's so many different things you can learn here. On top of our events, we have some cause marketing elements, some that I'm sure you've seen in the marketplace. The first on the top left is our Grounds for Hope program, supported deeply by Channel 4 and in Giant Eagle stores through Central Ohio, and by the roaster that's won so many national and international awards, Crimson Cup. We have Grounds for Hope that are available in a varieties of the grounds and also K-Cups with $2 and $3 from each package going to cancer support community, and you can find those in Giant Eagle. Next to that, we have our chocolate cards, which are at the florist within Giant Eagles, so you can add a note through chocolate, which is always a good thing. On the bottom left, recognize that label. We're about to introduce any day now in the Giant Eagle Market District stores a beautiful wine from Via Vecchia Wineries here in Central Ohio. It's a limited edition Malbec. It's a fine, fine wine. That's more than a hunch. It's really good. But we have the Hope wine, and that'll have a benefit to cancer support community Central Ohio as well. And also great programs from Rocky Boots and Durango, as well as from the state. We have the license plate that you see at the top is our ovarian cancer license plate, which has a special need and supports us at $25 a plate. So how can you get involved? Well, it is absolutely too late. You are all now involved. You have done something for me, and I hope that anybody and everybody in this room has learned just one thing about the need for support, that we're here and available to help. You're already armed. You've already become involved. What you do with that, it's up to you. Spread the word. Talk to somebody who's got a new diagnosis or knows someone. Talk to someone who you think could benefit by a conversation in our doors, in our satellite locations. Volunteer for some of our events, or just come eat way too much chocolate, drink wine, and play some golf with us. Any way that you choose, we're here to talk to you about what would fulfill your need for servitude and who you can help that's around you. So with that said, I thank you so much for listening to me go on and on about something that means an awful lot to me, Bev, Skip, our entire board, and on behalf of Judy as well. So thank you so much.
Thanks. This meeting's adjourned.